let me start. Our report today is 22 new cases, confirmed cases in Daviess County, and we had one new death. That new death brings our total in Daviess County to 159 deaths. And if you would, just let's take a moment and just a moment of silence for those folks who have lost their lives and won't be with us to celebrate this coming summer. Okay, thank you. And up on the screen, you can see where Jordan has placed the current cases, 9,550 confirmed cases. We've recovered 8,585, a total deaths 159. And the thing that really pleases me is we have 7 folks in Daviess County who are currently in the hospital. And that's way down from back just as short as 6 weeks ago. We had as many as 32 folks. You'll notice I have my mask on. Now I'm going to take it off. I'm in my office by myself. And I always wear this mask to show you folks how important it is. This is one of the tools, one of the few tools before the vaccines became available that we had to fight COVID. And the 3 W's, wear a mask, wash your hands, and watch your distance, is as valid today as cases are coming down, as our status, and Jordan, throw up the new map status, as our status moves from a red county to an orange county. And the other one is avoid really large crowds. Now, the governor, I noticed yesterday, has increased the capacities of certain businesses, including restaurants, to 60%, which is a good thing. But don't forget, and I'm going to paraphrase what Mayor Watson said at a city commission meeting, everything is looking good. We're really moving well. 3 weeks ago, this map was totally red. And today, the vast majority of the map is orange or yellow. We can't get cocky, though. We have to remember that COVID is out there, that the vaccine is one of the tools in our toolbox. It's an added tool, but one of the biggest tools is this mask that you wear. And we can point to it by the number of regular flu cases that have happened in Daviess County this year. They are practically non-existent. So anyway, as you see, Daviess County is down to 22.5 cases per 100,000. That's over a 7-year, or that's a 7-week average. I'm sorry, a 7-day average on a per 100,000. My sister counties in Union, Webster, Henderson, and McLean and Hancock are down in the yellow now, which is very pleasing. Our deaths have started to drop down, and I think part of the cases have started to drop simply because we have now made all the passes through the nursing homes and assisted living homes, so we've inoculated those who are very vulnerable. We've also had a couple of surges through our jail, through some of the recovery homes. As an example, look at Caldwell County down in the lower left-hand corner. Caldwell County right now has a rate of 239.8 cases per 100,000 population. That's simply a result of an outbreak in the prison there in Caldwell County. So we're doing a really great job. One of the things that's going to help us go from orange to yellow and from yellow to green will be vaccines. We really need to make a big push on getting vaccinated. And Jordan, go ahead and put up the other list. There on the screen is a list of the various places that you can sign up for a vaccine. Lots of places. Now, I would caution you, some of these businesses do not have vaccine yet. They will have it. They don't have it yet. The best thing to do is call them or get on the vaccine.ky.gov, and there will be eligibility screening information and contact information in order for you guys to get vaccinated. I've had both my shots. Robyn, I think later on, and Robyn, I don't think HIPAA prevents me from doing this as long as you shake your head to say it's okay, but she's had both of her shots, and the only thing that we notice are little sticky things growing out of her hair. But other than that, you feel fine, right, Robyn?
I do. I feel great.
So it's, remember this, folks, 90% of the deaths that occur in COVID occur in those who are 60 years old or older. We are right now in phase 1C, which says anybody 60 and older is eligible to get vaccinated. Once we get through that crowd, then we're going to dramatically cut the number of deaths, the number of people who are in the hospital. Also under 1C are essential workers. There's a long list of essential workers who can sign up to get a vaccine, even if you're not 60 or older. So I encourage you again to get on and look at the vaccine.ky.gov or go to kycovid19.ky.gov. A wealth of information, great, and I guarantee you this information is a lot more accurate than what you find on Facebook or on whatever some of these other electronic places are that you're going. Okay. Again, as I said, I have two very special guests today, and in this case, Robyn, ladies, don't go first. Ladies are going last because you got tons of information. I'll cut Dan off and give you lots of time. But we have Dan Lanham. Dan runs the GRITS operation for Audubon community, and GRITS is a transportation system. Dan, you can remove that WKU alumni mask now. Since
I don't really want to, Judge.
I know you don't, but I want, it's being a Brescia Bearcat, I'm tired of looking at it.
I'm pretty proud of my Hilltoppers.
Okay. So anyway, Dan, welcome. And why don't you tell us a little bit about your job at Audubon area? Tell us what GRITS is, what it stands for, and the one thing that I want you to talk about is the program that Audubon area and GRITS decided to introduce to help folks who needed transportation to get a vaccine. Dan Lanham, you're on.
Well, Judge, thanks, first of all, for letting me on here today to talk about GRITS. As you well know, as you pointed out, I love to hear myself talk, and especially like to talk about GRITS even more, but I'm going to try not to burn all of Robyn's time up. Robyn and I are classmates from high school, so we've known each other for a long time. And,
oh, my Lord, Robyn, tell me it's not so.
It is true. I knew Dan when he had hair.
Oh,
yeah,
Lord.
That's right. That was a long time ago.
He's got it now, but it's all under his nose.
Yeah. Robyn graduated summa cum laude, and I graduated thank you laude. They gave me a diploma.
Been there, done that, Dan. Yeah.
Yeah. Yeah. But GRITS has been around since 1977. I've been here about 16 years. And as you know, I came from the construction industry, so this was all new to me. But it's a great organization that does fantastic things. And it's, one of the more visible parts of Audubon area community service because you see the buses around everywhere. And we've started promoting some of the other programs that Audubon offers on our buses with bus wraps. But I get asked all the time, what does GRITS stand for? And
it's a breakfast food, right?
Well, no, it stands for stands for Granny's Riding into Town Safely.
There you go.
No, that's not what it stands for. It stands for Green River Intra-County Transit System. And we offer transportation services in 7 counties, the Green River District. And like I said, have been doing so since 1977. We do wheelchair transports and all types of transports. And people ask me all the time, this is probably the #1 question I get, is, well, who can ride with GRITS? And the answer to that is really simple, anyone. There's no qualification to ride with GRITS. All you have to do is call us and you can ride. And we'll take you anywhere you want to go. Now, the difference comes in that some programs pay for transportation, some do not. But you can also just ride as a paid fare. And it's pretty inexpensive to ride with us as a paid fare. And plus, we do transport wheelchairs, which is not common, obviously, for some of the other alternatives. But you asked me to talk about what we're doing in regards to COVID. And let me explain quickly a couple things we've done during this COVID crisis. We've put hand sanitizer stations on our vehicles. We've spaced passengers apart. We don't let as many people on the vehicle as we used to. And so we're taking a lot of steps. Our drivers are protected with masks. They also have gloves. They have sanitizing solutions. We do all sorts of things to protect people. So we're very conscious of what it takes to keep people safe in this environment. But one of the things our board and our leadership staff thought was important to do was to make sure that people that don't have a way to get to the location to get their vaccine, we need to help them get there. Because just like you said, Judge, we all need to wear a mask and we all need to get vaccinated. I heard Dolly Parton sing a version of Jolene today that she placed a vaccine in the words of the Jolene song, and it was great. And we are strong believers that everybody needs to get one. So what we're doing is we're offering a free service to get you to your vaccine. All you have to do is call us, and I've got 2 numbers, and I'll give those to you. You can either call our local number at 270-686-1651, or if you need to call an 800 number, this is our 800 number. It's 800-816-3511. Get in touch with one of our customer service representatives, and they'll get you scheduled. We need at least 24 hours advance notice, and we'll get you there to get your vaccine. And now, I know there are some circumstances where people are going and waiting and hoping that they've got some leftovers. We can't do that because of our scheduling. We need you to have a confirmed appointment, and we'll get you there in time for that confirmed appointment and get you home. And we're glad to do this service. Like I said, our board and our leadership staff felt it was an important thing to do.
You know, Dan, I was at that board meeting, and I was very proud that the folks who serve Audubon area through the board and the staff, it was 100% in agreement that we needed to provide this service. So it made me very proud to be a part of that organization.
Well, and I'm very proud of our staff here, Judge. I mean, we've placed them in some difficult situations, and they don't make a whole lot of money. Most of them are here because they feel like this is something they need to do to pay back the community for what the community's done for them. And we have been very blessed to have people who are willing to take some health risk on their own to deliver this service.
Right.
And we've got most of our people have had vaccines now. I've had my second one, and most of our people have now. But you know, it's hard to find somebody who's willing to place themselves in harm's way, as you well know, to deliver a service like this. And a lot of our staff have done that. Very proud of them for that.
Dan, just quickly, let's make sure that folks understand we're not going to transport someone from Daviess County to Jefferson County to get a vaccine up there. We're talking about intra-county, mainly Daviess County. And I'm not going to speak for you. I suspect if someone in McLean County had to come to Daviess County to get the vaccine, you would try to make arrangements, or Hancock. But this service is mainly being provided intra-county within the county that person resides. Is that correct?
That's correct, Judge. It will be within the county you reside in or an adjoining county.
Okay.
Just like you said, if you live in McLean County, you need to get to Daviess County to one of these locations you put up on the screen earlier. We'll get you there. But we just are limited in the capability to take somebody from here to Louisville or Evansville or somewhere like that. It's got to be in your home county or an adjoining county.
And I hate to ask what I'm about to ask because I set it up to fail, but this confirmed appointment, again, we want to make sure that when we take you, you're going to be able to get a vaccine, and we're going to take you pretty close to the appointment time, I would assume, because we are trying. I mean, we've got other people we've got to pick up and other people that we've got to take places.
This is coordinated public transportation. Now, what that means is there's going to be other people most likely on the vehicle with you. And in order to make all that work together, you need to be ready an hour before your appointment. And we'll tell you that when you call, and we'll pick you up in that window. Our goal, and what we're pretty good at most of the time, is to get you there on time for your appointment. And we may have to pick you up and you may have to ride on the vehicle a little bit longer than you might think, but that is to coordinate with other people. So yes, that's an important point.
Tell me, I'm interested in the grad region, the 7 grad counties: Hancock, Ohio, McLean, Union, Webster, Henderson, and Daviess. But Audubon area is much larger than just those 7 grad counties. Are you offering this service across the entire Audubon area service area? And if so, what are some of those other counties that we're serving?
Well, Judge, as you know, we actually serve 22 counties in Kentucky with the GRITS program, but we only offer public transportation in the 7 grad counties. So we're strictly offering this service in the 7 grad counties. Now, being part of the Kentucky Public Transit Association, I can tell you that I talk with my counterparts on a regular basis, and this is being offered in most counties in the state of Kentucky. And if someone from another region besides the grad region has a question, they can feel free to call me here, and we'll direct them to the agency that's taking care of their area.
Right. I think in the end, being an elected official whose number one priority is public safety and public health being very important in this COVID pandemic, if you have an issue and you can't get transportation, I know people don't hesitate to call me. They don't hesitate to call the mayor. Call my office. If you're in Daviess County or even surrounding counties, we've been very successful in helping people who have unemployment issues, and we'll do the same thing here, because our number one goal is to make sure that every person has an opportunity to get a vaccination. While I've got you, well, the other thing I wanted to say, and why this is so important, we've identified in Daviess County 3 census tracts where 15 to 25% of the households don't have transportation. That means that if there's a house on that block, if there's 100 houses on that block, 25 of those houses don't have a means to get out and to go get a vaccine. So we want to be aware and cognizant of those folks, their needs, and try to do our best to help them. I'm going to put you on the spot. I think you've answered this. I can't remember, but there for a while, because of federal governments, I want to be nice, because we weren't getting any money from federal government for transportation. We had to stop helping veterans in their transportation needs. Has there been a change there? Are we back to being able to help them?
What happened was
be nice now.
I'm trying to, but you and I are on the different sides of this fence. So back during the previous governor's administration, towards the end, Medicaid, which accounts for a huge percentage of our operation, the funds got very, very, very tight. We took about a $3 million hit to our budget. Our budget's about $16 million a year, and there was about a $3 million a year cut. And that made us do a lot of things we weren't happy with. And as you can relate to that, you've been in that situation yourself. It makes you do a lot of unpleasant things, a lot of unpopular things. And one of the things we had to do is we had been doing free medical transportation for veterans. We will take them to Evansville. We were taking them to the Owensboro Clinic and to their doctor appointments. And, as I say all the time, I am not a veteran, but I have a tremendous respect for people who have sacrificed, like our veterans have, to help our country. And I have veterans in my family that did, sacrifice, and it's an important thing. and we felt like it was an important thing to do. But unfortunately, when the money got tight, we had to cut some of those things out, and we did have to cut that out. During the current administration, Medicaid has stepped their funding back up to acceptable levels, put us in a situation where we're not in a financial bind, and we were able to start that program back up. So a veteran who needs transportation to a clinic or a doctor's appointment, we're going to get them there free of charge to them. And that's just our way of paying back what they have done for us. And we have several veterans on our staff, and I just think it's an important thing to do.
Well, you have several veterans on your board, including myself, and it absolutely is important. Many of our veterans suffer traumatic residual effects from. I was fortunate, I never served in a war. I was in during the Vietnam era. God spread his hands over me and kept me home. I had many friends who had a lot of health issues, particularly from Agent Orange. And while they didn't die in Vietnam, they died here, and they died a horrible death. And it's extremely important that we continue to keep our vow to them that you protected us, we're going to protect you. So I appreciate you being able to get that restored. And I thought it was important that the story that you told be told, and that it wasn't just an out of hand decision that we made. So you got anything else you want to tell us?
Well, we've got some exciting things going on here. We're getting ready to add on to the parking garage.
I wish I'd have never asked, Robyn. All right.
Okay.
Tell me about the parking garage.
We're going to add some office space on here. Fortunately, over the years, we've been able to grow. We've been here in the parking garage. It's hard to believe, but we've been here for about 12, 13 years now. And
St. Elizabeth and 2nd Street, right?
Yes. And we've been fortunate to grow in that time. So we're going to add some office space here. We've received funding approval from the FTA, which is part of the National Department of Transportation, through our local Department of Transportation in Frankfort and the Office of Transportation Delivery. We got funds to add on to the front of our building here and put some office space on. It also is going to help us with this crisis, this pandemic. We learned, we only had one men's and one women's restroom, and we had a small break room, and we can't spread out like we need to respond to a pandemic situation like this. So we're adding some restrooms, making our break room bigger, putting in our training room. We had unfortunately turned our training room into offices in the recent past. And so we're getting that back because we put a lot of emphasis on training and believe in training. The other thing we've got going on is on farther down 2nd Street at 2006 2nd Street is where our maintenance facility is. And the board was kind enough to put some of our funds towards adding some parking down there. We were woefully short on parking, and to renovate an existing building down there into storage. So that's underway, started today. And so we've got some good things going on here. We've got some new vehicles coming in. The state has been very, very kind to us and given us some funds to purchase some new vehicles. And the fleet's getting newer and better every day. It's in better shape than it's ever been since I've been here. And it's a great time for us right now.
Okay. Well, Dan, let's hope that everybody talks about us being in a new normal. Well, I don't like the new normal. I want to get back to the old normal, but I think something that's extremely critical is that we remember the lessons that we've learned during the new normal and don't forget them when we get back to the old normal, because this is a nature's way of reminding man how small he or she really is in the scheme of things. And this wasn't the first pandemic. It won't be the last. I tell people, my dad was born during the 1918 pandemic, Spanish flu epidemic, which lasted about 4 years. And he lost a sister in 1918. He was born in 1919. He lost a sister, a baby sister, in 1918. My dad was born, and his mom died toward the tail end of that pandemic. So if you don't think that these type of natural disasters, and that's what it is, don't have an effect hundreds of years out, I can show you the effect that that pandemic had on my family 100 years later. So thank you for what you're doing, Robyn. Save the best for last. The Robyn Mattingly, and again, no relation that I know of, although it must be because I know her husband. His head's as hard as mine. That means he's a real Mattingly. She serves in several capacities, but one of the biggest capacities that she serves in, and that's what I want to talk about first, is in the distribution of LIHEAP funds, low income economic assistance, yada. You're going to give us the real thing, but this is one of the things that I want to make sure that people understand.
Okay.
I listened to the governor yesterday talk about $240 million that had been placed in a fund to provide rent assistance, to prevent evictions, and to provide utility assistance to prevent cutoffs. That was about 2 to 3 weeks ago when that program started, and to date, they've had only 5,000 applications and $10 million distributed. Think about that. Here's a huge fund. And I know there are people, Robyn, we know there are people out there that could use those funds. So I don't know how we get the word out. We're trying to work on a program here in Daviess County. We're trying to run it through the 211 number that is used by United Way. David Ross did a wonderful presentation last night talking about the number of people who had the COVID relief fund that the city and the county and some other investors set up. But how do we get that information out there? So I want you to tell us about LIHEAP. I want to tell us about how it works, and then how do we get the information out to people so that we don't end up not dispensing 100% of the funds, because that's what we want. We don't want the money to sit in the bank for Audubon area. We want it to be in the hands of our customers, the people who really need it. Robyn Mattingly, the spotlight's on you.
Thank you, Judge, and thanks for having us on today. You want to talk about LIHEAP first. LIHEAP is one of the programs in the Social Support Services Department. It's probably the most, at least right now, forward-facing programs that we have, and it stands for Low Income Home Energy Assistance Program. It is the utility assistance program. It typically runs from November through March, but I can tell you, because of the pandemic, we have been running nonstop since November of 2019. We ran our typical fall subsidy. We went into our typical winter crisis. We then went into a spring subsidy, unheard of. We went into a summer cooling program, and then we went right into, we got some healthy at home funds, went right back into our fall subsidy, and now we're back into winter crisis. Now, all of those programs, what it means, they all have a little bit different maybe qualification or processes that we have to go through, but they were all funded through federal dollars through Community Action Kentucky, which is our headquarters in the state for all community action agencies. With Audubon area, we operate these programs in the 7 counties that you spoke of in the Green River area since April 1 of 2020. And that's when we really saw the pandemic starting to hit. Since April 1, with all of those different programs that I just mentioned, in Daviess County alone, we've processed 6,456 different applications, $1,472,000 in benefits. Now, that's not unduplicated, Judge, because what happened, people that had been assisted with our crisis season last year, they were eligible for spring subsidy. They were then eligible for summer cooling. They were eligible for healthy at home. So we've got some duplication in there, but the bottom line is there's $1.4 million in benefit dollars that have gone to help people with their past dues, their disconnects. Right now in crisis, we've run $227,000 just since January in
Let me
benefits.
stop you.
Mhm.
So in crisis, tell me what that means. Is that the, oh my God, I got a disconnect notice. If I don't pay my bill in 7 days, they shut the power off?
Yes, yes. In our crisis component, individuals have to be at 150% of the poverty levels, and that depends on the number of folks in their household. They have to have
Less than 150%, 150% or below.
or less. Yes, yes. Thank you. Again, depends on the number in their household. They have to have a disconnect, a past due, or present to us an arrearages payment plan that the utility companies are working with right now. Or if they're on bulk fuel, if they're on propane, kerosene,
Good.
wood, they have to be within 4 days of running out of fuel. So we work with those individuals. They have to provide social security numbers for everybody in the household, proof of income for everybody in the household, and then again, present us with those disconnects. Now, the pandemic has played havoc with our actual service delivery. And I want to explain that because there is a great demand right now, but we are not able to see anybody face to face. That was a decision for all of our programs within all of our agency. We're not seeing folks face to face, except for Dan and Head Start.
Okay, let me real quick. So when you can't see them face to face, if I don't have a cell phone, if I don't have a computer, can I still call and can you help them over the phone?
Absolutely. We've got several different ways that we're able to assist our clients. We have the telephone. We have it in Daviess County. We actually have a drop box at our back door where individuals can bring their information. They put it in a secure envelope. It's in a box. We go out there and get the information, bring it in, process the applications. We also, people can email, they can text, they can scan, and we have a new web portal on the Audubon area website, and I can give that link to you, where individuals can go in, they can download an application from us, they can upload all the required documents to us. They don't ever have to leave their home. And it's actually the quickest way to get to us. Now, our phone number, if they want to call, is 270-686-1662.
Say that again. Say that again.
270-686-1662.
Okay.
We have 4 individuals that are taking calls at this time, but we're having hundreds of calls. So people, when they finally get through, they'll say, I've been trying to call, I can never get through. People will contact other partners with us. Well, I've tried Audubon area, I can't get a hold of anybody. Leave a message. We have voicemail, leave a message. I promise you staff will get back. We can't have all of our staff in the office at the same time because we have to have reduced capacity. We have folks that are working at home. So the very best way is that website, and that's www.audubon-area.com. On our homepage down at the bottom, there is a button that says request assistance. You click on that and it'll take you right to the page where you need to go. You can either schedule a call back from one of our staff members and you pick the time and the day, or you can go ahead and download your app, upload all your documents and be done. So,
just quickly, Robyn, I was involved in a PPP loan for a private business. Everything was done from the office. Everything was downloaded, uploaded, and not one time was there a personal face-to-face visit. It was extremely easy and very quick. And for not computer savvy people like me, it was very easy.
and that truly is the best way, but we have to remember, Judge, there's a lot of individuals, especially our seniors that don't have the capacity. I know my mom still uses a flip phone. There wouldn't be any way that she'd be able to do that. So
we gave Judy a new iPhone for Christmas several years ago, and my son said it's the worst thing we ever did because he had to sit next to his mother for about 6 months trying to learn her how to use that thing.
I understand. I understand.
Real quickly, and I don't want you to get off, but one of the things I was pleased to hear, and you've said it before, but there is not a lot of help for people with bulk fuels, LP gas, oil, and wood. There is not a lot. A lot of these are for utilities, and these are not utilities. So that would be number one. But number two, has there been any modification in LIHEAP funds be used for water and wastewater?
There was back in November and December with the Healthy at Home. Right now, Judge, there is not. The only utilities that we are able to assist with would be the metered fuels and the bulk fuels. That would be go ahead.
Just for those that are listening, Daviess County is in the process. Now, when we get it, who knows? Because I know the city was in the process in April and finally got theirs in November of getting some funds, utility assistance funds, which would apply also for water and wastewater. We're hoping maybe we see it in April, late April or May, but it could be as late as August. But there would be some assistance that we would be able to help county residents through.
Well, that's what we understand, but quite honestly, Judge, and I listened to the public hearing that fiscal court held a couple of weeks ago, and that's the only information that we have gotten to this point. So it would be great because I know the water and wastewater, there is such a need. We actually went through our allocation back in November and December where we were able to help with that in just a matter of 3 or 4 days.
Well, and for folks, I mean, our plan, since Audubon area already runs the LIHEAP, would be to partner with Audubon area. You've got that database and all the other information. And the good thing about this program is that it has no income restriction. None. You just have to be past due and all those kinds of things. So go ahead. I didn't mean to jump in.
No, that's fine. We're waiting to hear more about that as well. You mentioned earlier the governor's announcement that there was several $100 million for rental assistance and utility assistance. That's actually, to the best of my knowledge, Judge, that is being operated through Kentucky Housing Corporation.
Yes,
so individuals can go on the kentucky.gov website and apply for that. That is one area that Audubon is not involved in currently.
And not only individuals, but property owners.
Yes,
they
that is
also
correct.
Go and on behalf of, or the renter on behalf of. Yeah.
But you're right, Judge. We get a lot of calls. People say, I heard the governor say there's going to be this money available. What we do is give them the proper website to go to for that. We do have a number of other programs within our department that have been assisting during the pandemic. For instance, we operate the Connect program. That is for individuals that are underinsured or uninsured for their health insurance. Well, a lot of people have lost their jobs during the pandemic. So the state has designed what they call presumptive eligibility. Anybody that's lost their job and they've lost that insurance, they can apply for Medicaid through our connectors. They go through and help them through that process in order to get at least some health coverage during this time until they can go back to work. And they've done thousands of applications since the pandemic started. We have taken other precautions. Owensboro Regional Recovery in our department as well. They've taken a number of precautions to keep the residents there as safe as possible. We operate the AmeriCorps Seniors Foster Grandparent Program, Senior Companion Program, RSVP. Now those volunteers are all age 55 and older, the most vulnerable population when COVID hit. So they have not been in service whether it's in the schools or in private homes or in some of the other areas, because they've not been able to.
Do
We
they,
have had-
do they qualify under essential workers? Could we get them qualified under, I mean, because they're forward facing, they're out in the public, and what they do is very critical for our community. Has there been any attempt to?
What we are doing, yes, Judge, we're actually doing surveys with all of our volunteers to see if they have had the vaccination, if they intend to get the vaccination. We tell them that Grits is able to provide that service to
Good.
them at no charge if they need transportation. What we're also running into, though, is that right now schools aren't letting any volunteers
Right.
in, so our foster grandparents aren't able to serve. The senior companions, they have not been, while we were in the red zone, they've not been going into homes. Now they're starting to go back in. But it will be, I think, a strong protection and comfort for not only our volunteers, but those that they serve, to know that they have received the COVID-19 vaccination. We think that that is important, and we're trying to get that arranged. And if they need help scheduling appointments, I've got staff that are able
Good.
to help them with that. We've got caregivers with our senior companion program, family members that have had to leave work because someone's not been able to come in and care for their loved one. We would normally have a volunteer in there to help take care of mama or dad or husband, or now we're able to go back in to relieve them so they can go back to work. It's just been a whole cascade of issues from top to bottom, and we're trying to navigate these COVID waters as best we can and still deliver the number and the quality of services that we want to do. Our family preservation program, where we visit these families that are at risk of losing their children because of situations within the home, our specialists weren't able to go in and work and counsel with these families. But they've been doing porch visits, they've been doing sidewalk visits, they've been doing Zooms, they've been doing everything they can. We are ready to get back into the homes and do what we need to do. And Judge, I'm going to go back to LIHEAP real quick, because I know this is something that we have talked about over the years. We actually have renovated our Owsley building here at 1800 West 4th to accommodate not only protective procedures for our staff and clients. We have our intake room is completely redesigned. We've got cubicles with plexiglass separating staff and clients so that nobody gets breathed on or coughed on. We've got security measures put in place inside the building, and outside we've got an awning where individuals don't have to stand. They still have to stand outside, but when we get back to in service, they won't be in the rain and snow.
Good. How many times have I hollered and screamed and complained about seeing those lines early in the morning, because those folks would line up at 6:30, 6:45, because they really need the service so bad, and they would show up. Well, we were planning on an hour and 30 minutes. If I can wrap it up here in 1 minute, we've made an hour and 45 minutes, but we could probably spend 2 or 3 hours talking about the things we do. I just want to say that during this pandemic, this last 11, almost 12 months now, I never gave up hope. And the staff at Audubon area never gave up hope. And we're going to come out better for going through the pandemic on the other side. And we're going to be able to say that we continue to do what was best for our community, regardless of what that damned old virus tried to do to us. So I want to thank you guys. Pass it along to the staff that we are very grateful as a community, as a county, and as a region for having Audubon area. And I look forward to maybe calling you guys again, and perhaps a year from now, let's talk about what went on in the olden days. Remember when Dan had hair and building. So thanks for being with us. It was very enjoyable. Folks, I hope it was very informative for you. Just one thing before I go, somebody last week, and I absolutely agree with what was said by this gentleman, but he said, why don't you give us some good news? Tell us about the vaccine. So as of Friday, this past Friday, 32,109 doses had been administered in Daviess County. Now, and that's through the state program. Doesn't include the nursing homes and any federal allocations to the pharmacies. And 21,000 of those were first doses. Some of them went to residents outside of our county. Remember, Owensboro Health is a regional hospital, and they will give it to folks, as I have heard some Daviess Countyans have gone to Henderson or to Muhlenberg County. 1,521 people were vaccinated through the LTC program. Clay Horton thinks I'm a mind reader, know what LTC means. It actually means long-term care program, I'm going to assume. We don't put the data out very often simply because it's problematic in trying to report those people. What we're trying to do is do it by zip code, but it's really tough. There are literally hundreds of entities that are involved in this that we have to collect the data, and it's hard to do sometimes, because what we don't want to do, we want to make sure the data we report is accurate. The worst thing in the world is to give you some inaccurate data and you take it to the bank and then find out the check bounced. You're not going to like what I tell you next time going around. So anyway, folks, thanks for being with us. Jordan, you can take us out. We'll see you next Wednesday.